Hey there. Have you ever uh scroll through social media and just kind of thought like, wait a minute, maybe I have ADHD?
Mm.
It's a thought, right? You're
Yeah,
definitely not alone if you have.
not at all,
No,
no.
because a recent study actually found that a pretty big 25% of adults think they might have undiagnosed ADHD.
Wow.
And a lot of that is thanks to increased awareness from, you guess it, social media.
Social media, yeah.
So whether you're here because you relate to that 25% or you just want to understand this condition that everyone's talking about, buckle up
Hmm.
because we are diving deep into the world of adult ADHD.
It's definitely become a hot topic,
Yeah.
and for good reason. There's
Yeah.
a lot more to it than just forgetting where you put your keys or
Hmm.
having trouble focusing every now and then.
Right.
We've got three really fascinating research articles here today.
Okay.
One looking at this potential undiagnosed ADHD epidemic,
Okay.
another diving into the long-term effects of medication, and then a third one that highlights some of the risks that are associated with certain ADHD meds.
So let's start with that epidemic,
Yep.
25%.
Yeah.
That's a big number.
It is. It is.
But would some people argue that even if it's from social media, isn't increased awareness a good thing?
Oh, it absolutely can be.
Yeah.
I mean, bringing ADHD into the open helps break down the stigma around it,
Hmm.
and it encourages people to actually seek help, which is great.
Right.
But what's concerning is that of those people that suspect they have ADHD, only 13% actually talk to a doctor.
Oh, wow.
So that means most people are relying on self-diagnosis,
Right.
which can be a little bit of a slippery slope.
So it's not as simple as taking an online quiz and then deciding, yep, I need medication.
Not at all. No,
Okay.
ADHD shares symptoms with other conditions,
Oh, okay.
like anxiety and
Ah.
depression.
Gotcha.
So imagine struggling with focus and restlessness,
Right.
thinking it's ADHD,
Yeah.
and treating it the wrong way. You could actually make things worse.
Oh, no.
One of the psychologists that we're looking at today put it perfectly.
Okay.
They said anxiety, depression, and ADHD can look a lot alike, but the wrong treatment can make things worse instead of helping that person feel better.
That's a scary thought.
Yeah.
Getting the wrong help when you're already struggling.
Right.
Okay, so before we go any further,
Okay.
let's break down what ADHD actually is.
Right.
It's more than just being forgetful or fidgety.
Right. It involves problems with attention, focus, and restlessness that are severe enough to cause ongoing challenges in your daily life.
Okay.
So think about it this way. It's not just about occasionally misplacing your keys.
Right.
It's about those moments of inattention or impulsivity,
Yeah.
affecting your work, your relationships, even your ability to manage simple tasks.
So this isn't just a childhood thing.
No.
Adults can have ADHD too, right?
Absolutely. While it's often diagnosed in childhood, the symptoms can continue on into adulthood. And some people aren't even diagnosed until later in life.
Interesting.
Yeah, and that's partly because the symptoms can manifest differently as we age.
So the stereotypical image of a kid bouncing off the walls
Yeah,
might not apply to adults with ADHD.
exactly.
Oh.
Hyperactivity might be less obvious, while challenges with memory, concentration, and even emotional regulation become more prominent.
Wow.
Plus, you have the added layer of stress.
Oh, yeah.
Something a lot of adults can relate to.
For sure.
Sure.
Does stress actually make ADHD symptoms worse?
It can, definitely.
Wow.
Imagine already struggling to focus, and then life throws you a curveball.
Oh, yeah.
A work deadline,
Mm-hmm.
a family issue,
Yes.
you name it.
Yeah.
That stress can amplify those existing challenges,
Oh.
making it even harder to stay on track.
So it's like a double whammy.
Mm-hmm.
Okay, well, this is already making me think differently about ADHD.
Good.
It's clearly a lot more nuanced than what you might see on social media.
It is, yeah. And that brings us back to that 13% statistic. Okay. If you have concerns, seeing a qualified professional is crucial.
Right.
They can help you figure out what's really going on
Mm-hmm.
and create a treatment plan that's tailored to your unique needs.
Right.
That might involve medication, but it could also include therapy,
Right.
lifestyle changes, or a
So-
combination of approaches.
Speaking of medication, that's a big part of the conversation around ADHD.
It is.
Both online
Yeah.
and in the medical community.
Mm-hmm.
One of the research articles we have today actually dives into the long-term effects of ADHD meds on cognitive function.
Yeah.
What did they find?
Well,
Give us the good news first.
the good news is that both stimulant medications like Adderall
Okay.
and non-stimulant medications like atomoxetine
Gotcha.
can significantly improve cognitive function in people with ADHD. And these benefits can last even with long-term use.
That's reassuring to hear,
Yeah.
especially since there are sometimes concerns about the long-term effects of those medications.
Absolutely. And this particular research is significant because it looked at those long-term effects,
Right.
which is something that's much more clinically relevant than just studying the effects of a single dose.
So it's not just a temporary boost.
Yeah.
These medications can have lasting benefits.
That's what this research suggests, yes.
Okay.
They found improvements in several key areas.
Okay.
Attention, inhibition, reaction time, and working memory.
Okay, break that down for me.
Okay.
What do those improvements actually look like in someone's daily life?
Well, imagine being able to focus better at work,
Okay.
follow conversations more easily,
Hmm.
and make fewer impulsive decisions.
Fewer like foot and mouth moments for us?
Right, exactly.
But seriously, this highlights how ADHD affects not just our work,
Yeah.
but our social interactions too.
Exactly.
Right.
Then you have reaction time, which is crucial for things like driving,
Yeah.
and working memory, which is essentially your brain's ability to hold information and manipulate it.
Right.
Think about remembering a phone number. Mm-hmm.
Or following a complex set of instructions.
So for you, this could mean sharper focus at work, fewer impulsive decisions,
Right.
quicker thinking,
Mm-hmm.
and a better ability to juggle information.
Yeah,
A real boost for daily life.
precisely.
But we can't ignore the potential downsides of medication, right?
Right.
The third research article we have focuses specifically on the risks associated with certain ADHD meds.
Yeah.
What did they find?
This study looked at the link between high doses of certain ADHD medications and an increased risk of psychosis or mania.
Okay, that sounds serious.
Yeah.
Which medications are we talking about here?
The study found that high doses of amphetamine-based medications, like Adderall,
Okay.
were linked to a 5-fold increased risk of developing psychosis or mania.
A 5-fold increase.
Mm-hmm.
That's alarming.
Yeah.
What does this tell us about how we need to approach prescribing these medications?
It definitely emphasizes the need for careful monitoring by doctors,
Mm-hmm.
especially for patients who might have existing mental health risks. So it's not just a case of, here's your prescription, see you later.
Not at all.
Okay.
It's about personalized treatment and close monitoring.
Mm-hmm.
The study actually found that 81% of the psychosis or mania cases linked to amphetamines could have been avoided with lower doses.
Oh, wow.
Yeah.
So that 30 milligram threshold you mentioned earlier
Yeah.
is important
Mm-hmm.
because it highlights that higher doses carry a greater risk.
Right.
It's a reminder that medication needs to be carefully tailored to your individual needs,
Yes.
not a one-size-fits-all approach.
Exactly.
And it's important to note that this study focused specifically on amphetamine-based medications like Adderall.
Mm-hmm.
They also looked at methylphenidate,
Right.
which is commonly known as Ritalin,
Uh-huh.
and didn't find a similar increase in psychosis risk.
No, they didn't.
So it seems like different medications within the same class can have very different risk profiles.
That's right.
Okay.
And it reinforces the need for individualized treatment plans.
Right.
What works for one person might not work for another.
This is all incredibly important information.
Yeah.
But I'm sure some of our listeners are wondering, okay, why should I care?
Well, if you're one of those people who suspect they might have ADHD, remember that social media can be a great starting point for awareness.
Yeah.
But it's not a substitute for professional evaluation.
Right.
Only a doctor can give you an accurate diagnosis and help you navigate the complexities of treatment options.
Right. So taking that awareness you gained online and turning it into informed action.
Exactly.
So what's the first step?
Reach out to a qualified healthcare professional.
Okay.
They can assess your symptoms, rule out other conditions,
Gotcha.
and if necessary, help you create a treatment plan that addresses your individual needs and goals.
So it's not about slapping a label on it,
No,
but about developing a roadmap for moving forward.
precisely.
Okay.
And remember, seeking help is a sign of strength, not weakness.
Great advice.
Thanks.
So it's really about empowering yourself
Mm-hmm.
to take control of your health.
Right.
And that starts with understanding the facts.
Yeah.
Speaking of facts, that statistic, about 25% of adults suspecting they have undiagnosed ADHD.
Right.
Where did that number actually come from?
That came from a survey conducted by the Ohio State University Wexner Medical Center
Okay.
and College of Medicine.
Gotcha.
They surveyed 1,000 American adults
Okay.
across different age groups.
Okay.
And it's really fascinating to see how those age groups responded.
Oh, I'm all ears.
Okay. Yeah.
Tell me about the age breakdown.
Well, younger adults were significantly more likely to suspect they had undiagnosed ADHD.
Okay.
compared to older generations.
That makes sense considering how much more prevalent the ADHD conversation is online these days.
Right. Yeah.
Social media has really opened up the conversation around mental health
Yeah.
in a way that we haven't seen before.
Mm-hmm.
It's almost like younger adults are getting this informal education
Yeah.
about ADHD
Mm-hmm.
that previous generations just didn't have access to. It's fascinating to think about how those online conversations are shaping people's understanding of their own mental health.
It is.
But like we talked about earlier, there's a big difference between awareness and
Right.
self-diagnosis.
Huge. Yeah, absolutely.
Yeah.
While it's great that more people are aware of ADHD, it's crucial to remember that social media isn't a substitute for professional evaluation.
Right.
It's important to have those credible sources of information to
Right.
cut through all the noise.
Definitely.
Yeah.
Speaking of credible sources,
Okay.
that brings us back to the research we're looking at today.
Mm-hmm.
We've covered the prevalence of undiagnosed ADHD,
Yeah.
the challenges of diagnosis,
Right.
and the potential benefits and risks of medication.
Mm-hmm.
But what about those who were diagnosed with ADHD as children?
Oh, okay.
Do they continue to experience symptoms into adulthood?
That's a great question.
Yeah.
And the answer is often yes.
Oh, wow.
In fact, one of the categories of adults with ADHD
Hmm.
is those who were diagnosed in childhood and continue to experience symptoms.
So it's not something you just grow out of.
Right.
I think there's a misconception out there
Definitely.
that ADHD is just a childhood condition.
Right. And that's not always the case.
Okay.
Even for those whose symptoms seem to lessen as they get older,
Mm-hmm.
they might still experience challenges in certain areas of their life,
Right.
especially when they're under stress.
There's that stress factor again.
Yeah.
It seems to be a big trigger for ADHD symptoms.
It is.
Yeah.
Stress can make those existing challenges with focus,
Mm-hmm.
organization, or
Yeah.
impulsivity
Yeah.
even more pronounced.
Wow.
Those symptoms get amplified
Okay.
when you're dealing with difficult situations.
So what can people do about that?
Mm.
Are there ways to manage that stress
Mhm.
so it doesn't completely derail you?
Absolutely.
Okay.
Learning effective coping mechanisms
Okay.
is a crucial part of managing ADHD,
Mm-hmm.
regardless of whether you were diagnosed as a child or an adult.
What are some of those coping mechanisms?
Well, it can be as simple as making sure you're getting enough sleep
Okay.
and exercising regularly.
Right.
Those things have a huge impact on your overall well-being
Yeah.
and can make you more resilient to stress.
So it's about building those healthy habits
Mm-hmm.
that support your mental and emotional health.
Exactly.
Okay.
And there are other strategies too,
Okay.
like mindfulness techniques, setting boundaries,
Gotcha.
and prioritizing tasks.
Okay.
It's all about finding what works for you and
Right.
building a structure that supports your success.
It sounds like it's an ongoing process.
It is, yeah.
Not just a quick fix.
Managing ADHD is a journey, not a destination.
I like that.
Yeah.
Okay.
It's not about finding a magic solution,
Right.
but about developing sustainable strategies
Yeah.
that help you live a fulfilling life.
That's what we all want.
Right.
Yeah.
And that might involve a combination of approaches,
Okay.
medication, therapy, lifestyle changes.
So it's not a one-size-fits-all approach.
Definitely not.
Okay.
What works for one person might not work for another.
Mm-hmm.
So it's about finding the right combination of tools and support
Right.
that helps you manage your ADHD effectively.
And that's where working with a qualified professional comes in.
Exactly. They
Yeah.
can help you create that personalized plan.
Mm-hmm.
They can help you assess your individual needs,
Okay.
explore different options,
Gotcha.
and figure out what's going to be most effective for you.
Yeah.
It's about empowering you to take control of your ADHD
Right.
and not let it control you.
This has been such an eye-opening conversation.
Yep.
We've covered so much ground.
We have, yeah.
The prevalence of undiagnosed ADHD,
Mm-hmm.
the challenges of diagnosis,
Right.
the potential benefits and risks of medication,
Yeah.
and the importance of a personalized approach to treatment.
We've really delved into the complexities of this condition.
And I love that we've emphasized that there's no shame in seeking help. It's a sign of strength and self-awareness.
I completely agree.
Yeah.
It's about taking that first step towards understanding yourself better
Mm-hmm.
and getting the support you deserve.
Now, before we wrap up,
Okay.
I'm curious to hear your final provocative thought
Okay.
for our listeners.
Sure.
What's something they can ponder as they continue their own deep dive into ADHD?
Well, we've talked a lot about medication, And rightfully so.
Right.
But I think it's important to remember that there are many non-medication approaches to managing ADHD in adults
Okay.
that are incredibly effective,
Interesting.
both on their own
Okay.
and alongside medication.
Yes. Tell me more about those non-medication approaches.
Okay.
I think that's something a lot of people are curious about.
There are so many options out there.
Okay.
For example, there's cognitive behavioral therapy, or CBT.
Okay. See,
CBT helps you identify and change negative thought patterns and behaviors
Gotcha.
that might be contributing to your ADHD challenges.
So if you're constantly telling yourself you're not good enough,
Right.
or that you'll never get organized,
Yeah.
CBT can help you challenge those thoughts
Mm-hmm.
and develop a more positive and realistic mindset.
Exactly.
Okay.
It's about reframing those negative thought patterns and replacing them with more helpful ones.
I love that.
Yeah.
It's like retraining your brain to work with you, not against you.
And that's a great way to put it.
Yeah.
And then there are mindfulness-based therapies,
Okay.
which can be incredibly helpful
Yeah.
for people with ADHD who struggle with racing thoughts
All right.
or difficulty staying present.
I can see how that would be beneficial.
Yeah.
It's about learning to calm that inner chatter
Yeah,
and focus on the here and now.
precisely.
Okay.
Mindfulness helps you become more aware of your thoughts and feelings without judgment,
Mm.
which can be incredibly empowering.
What other non-medication approaches are there?
Well, there are a lot of practical coping strategies that you can incorporate into your daily life.
Okay.
Things like creating routines, breaking down tasks into smaller steps,
Okay.
using visual aids like calendars or to-do lists,
Yeah.
and setting reminders on your phone.
Those are all great tips.
Yeah.
It's about creating a structure that supports your success and helps you stay on track.
Absolutely.
Yeah.
And the beauty of these non-medication approaches is that they empower you to take an active role
Okay.
in managing your ADHD.
Right.
It's not just about relying on a pill,
Right.
but about developing skills and strategies
Yeah.
that you can use throughout your life.
I love that.
Yeah.
It's about taking ownership of your ADHD
Mm-hmm.
and finding what works for you.
Exactly.
It's not about letting it define you,
Right.
but about finding ways to thrive.
Exactly.
Yeah.
And remember, there are resources available to help you along the way.
Cuts.
There are support groups,
Right.
online communities,
Mm-hmm.
books, websites.
Yep.
You don't have to do this alone.
Yeah. It's so empowering to know that there's like a whole toolkit of strategies out there beyond just medication.
It really is. And I think that's what makes this deep dive so valuable for our listeners.
It's about giving them the knowledge and the resources to kind of take charge of their health and well-being.
Exactly. Whether they, think they might have ADHD or have a loved one who's struggling or just want to understand this condition that everybody's talking about, we've given them the facts to go beyond those catchy TikTok videos and have a more informed conversation.
And to know when it's time to reach out to a professional.
That's the most important takeaway from all of this. If you have concerns about ADHD, talk to a qualified healthcare professional.
They can provide the personalized guidance and support that's like essential for navigating this complex condition.
Absolutely. And remember, there's no shame in seeking help.
It's a sign of self-awareness and a commitment to, your own well-being.
Couldn't have said it better myself.
On that note, I think we've reached the bottom of this deep dive.
We've certainly explored a lot of fascinating territory today.
Thank you so much for sharing your expertise with us. It's been a truly insightful conversation.
It's been my pleasure. And to our listeners, I hope this information empowers you to prioritize your mental health and seek the support you deserve.
And remember, keep driving deep and stay curious.
Until next time.